Are you moving forward with trying to get a medical certification to sell this into actual hospitals?
Yeah, this is one of the steps that we would like to take indeed. Currently, one of the most promising trials is for sepsis diagnosis, and that is where we will, maybe in the coming year or so, plan to start a bigger trial to submit for medical device certification. So we have now done a smaller trial, like a pilot with something like 25 patients or so far. And then you need to submit a larger trial with all the paperwork, and then you get your medical device certificate. So yes, this is in the plan somewhere along the way.
Yeah, I know that's a very complicated process. And I assume you're hoping to do it across a lot of different countries also, achieve that medical device certification.
Yes. I mean, that also makes it more complicated. Like, for example, for US, they want things in US soil, as you might know. So then you need to do your experiments in different countries eventually. Yeah.
From my reading on the sepsis identification process, it sounds like Quantum Nova can speed that up dramatically, again, because you're measuring cells in real time as opposed to measuring cells that are dead. Figuring out that sepsis is there today, I think, usually takes several days or weeks, and you're basically going to shorten that. That could save a lot of lives, no?
Yeah, so what we are looking at is the patients that come in the emergency department with suspected sepsis, and then usually what happens is within a day or two or something, they either become better or they deteriorate. And what we would like to do at this early stage, right when they come in, is to triage them. Okay, this one is going to be fine. This one needs attention. This one, So to predict what's going to be the outcome. And at this stage, sepsis is also very, very difficult to diagnose. So there is a really high chance, I think 1 in 4, if I remember correctly, is misdiagnosed at that stage. So it's really, really difficult to diagnose. And it's also a stage where the mortality rate increases by 5 to 8% for every hour that you diagnose later. So if you diagnose a day earlier, you can imagine what that means for the patient. So you can really, hopefully still help those patients. So this is also one of the biggest applications where we can really have an impact.
LGD in Tech is now LattiSpec, a global tech diamond marketplace for buyers and sellers. From diamond material to subcomponents to equipment, post-growth treatment, and services, LattiSpec helps bring more transparency and speed to the technology-grade grown diamond supply chain. Built for aerospace, defense, semiconductors, quantum, photonics, optics, and more, LattiSpec connects you with verified global suppliers across 10 verticals. LattiSpec is where the tech diamond market connects.
What else are you working on that you can share with us for the future, or what expansion of Quantum Nova do you see happening in the next generation?
Yeah, I mean, on the one hand, we still work a lot on this, making it more user-friendly. I think eventually it would be ideal if you can just place a sample and leave. So especially if you consider you have a nurse in the ICU or something like that, or in the emergency department, they don't want to play with equipment. They need to treat their patients. So you would like to have some automation there. Right now, it's already better than where we started, but it's still not quite there yet that you can just place. And the other thing where automation helps a lot is to make the decision-making process more robust, more reproducible, less dependent on the user. So this is still a big part, like to make it self-driving, if you want. Then we are also looking forward, can we combine it with other readouts to make it more even more meaningful what we get out of it. Yeah, also the throughput. At the moment, we typically measure very few cells. But if you think pharma, for example, they always want to measure many cells, right? So right now we measure in these small plates, and then you can measure a few cells. But we are now moving to well plates. So there are these, in pharma, they are used to using these well plates. For example, a 96 well plate has like 96 containers where there is a sample. Now one of the goals is to make our technology compatible with that so that you can use their well plates and then go and test all those 96 drugs that they put in their wells or however many they want to fill. So throughput is another big thing where we are working on. And then, it requires, for example, that you have automated sampling, because if you there's not much use if you can use a 96 well plate. If then the user has to sit next to it and every time add something, then you might as well not have high throughput. So these are things we're working on.